hamstring muscles. The hamstring muscle group is found on the back of the thigh. It is composed of 3 separate muscles that cross both the hip joint and the knee joint. First, we have the semimembranosus and the semitendinosis, and finally the biceps femoris. The hamstring muscle group functions to restrain trunk flexion, as when bending at the waist, and is active in walking, running, jumping, and bicycling activities. Let's take a look at the semimembranosus landmarks. We have the femur, the tibia, the fibula, the knee joint, and the pelvis. The origin of the semimembranosus is on the ischial tuberosity of the pelvis, and it inserts on the posterior medial aspect of the medial condyle of the tibia. Contraction of the semimembranosus produces hip extension and knee flexion. The other hamstring muscles and the gluteus maximus and adductor magnus are synergistic during hip extension, and again the other hamstrings and gastrocnemius are synergistic during knee flexion. The iliopsoas and rectus femoris oppose the semimembranosus during hip extension, and the quadriceps femoris group opposes this muscle during knee flexion. Now let's take a look at the semitendinosis landmarks. You'll notice they're the same as the semimembranosus. The origin of the semitendinosis is on the ischial tuberosity of the pelvis, and the insertion on the medial side of the tibia at the pes anserinus. Contraction of the semitendinosus again produces hip extension and knee flexion. The synergistic muscles for hip extension are the other hamstring muscles, the gluteus maximus and the adductor magnus. And for knee flexion, the synergistic muscles are again the other hamstring muscles and the gastrocnemius. The iliopsoas and rectus femoris oppose this muscle during hip extension, and again the quadriceps femoris opposes this muscle during knee flexion. Let's take a look at the biceps femoris landmarks, the same as the other 2 hamstring muscles. Now the origin of the long head of the biceps is on the ischial tuberosity, and the short head of the biceps femoris is along the linea aspera of the femur. The insertion is on the head of the fibula. Contraction of the long head of the biceps femoris produces hip extension, while contraction of both heads of the biceps femoris produces knee flexion. The other hamstring muscles and the gluteus maximus and adductor magnus are synergistic during hip extension, and again, the other hamstring muscles and the gastrocnemius are synergistic during knee flexion. The iliopsoas and rectus femoris oppose the biceps femoris during hip extension, and the quadriceps femoris group opposes the biceps femoris during knee flexion. And here we have a look at all of the muscles of the hamstring group. Clinical findings for the hamstring trigger points. Clients with active trigger points in the hamstring muscle group will typically complain of pain in the posterior thigh and knee that gets worse when walking and could cause a limp. They may also complain of pain in the buttocks, in the back of the thigh and the knee while they're sitting. The pain usually disturbs their sleep, and sometimes they can complain of quadriceps femoris symptoms like knee pain and upper thigh pain due to the prominent antagonistic relationship between these muscle groups. Some activating factors for hamstring trigger points include physical compression of the trigger points by sitting in a poorly fitted chair, as if the chair is too high and actually compresses the trigger points. Bending at the waist for a sustained period of time. And sitting with your legs crossed for long periods of time. The adductor magnus, the quadriceps femoris, and the gastrocnemius trigger points are all associated with the hamstring trigger points. Referred pain from the piriformis and the gluteus minimus trigger points will often activate hamstring trigger points. And also, various muscles in the back and neck can develop trigger points from the postural distortions that are caused by tight hamstrings. Clients with active trigger points in the hamstrings are commonly misdiagnosed with sciatica or post-laminectomy syndrome, and growing pains in children is also a common misdiagnosis.